Hello, everybody. Good morning. And for some of you joining us from international countries, good afternoon. Thank you for coming today. I'm Abby from Precisionary Instruments. And on behalf of our company, I'm excited to host and introduce our webinar speaker, Professor Seungwoo Kang. Dr. Kang is an assistant professor at the Medical College of Georgia in Augusta. Dr. Kang's research focuses on the cellular and molecular mechanisms underlying brain activity in psychiatric disorders, and he has a special interest in neuron astrocyte interactions and their impact on behavior. So in today's webinar talk, Professor Kang will share insights on astrocytes' role in synaptic function and behavior, along with the experimental tools he has used to study neuroastrocytic interactions. And with that, please join me in welcoming Professor Kang. Hi, I'm going to hand it over to you now.
Thank you, Abby. So kind introduction. Hi, everyone. I'm Seungwoo from Augusta in Georgia. I'm so happy to have a chance to introduce my research interests and also meet you guys in the webinar like here. As Abby said, I'm very interested in how our brain is working to make some kind of behavioral consequence, especially by the interaction between neuron and astrocyte. How they intermingle together to make some kind of consequence of behavior in specific condition. Now, these days, I'm especially studying in social behavior and alcohol use disorder and how those are working for brain widely to make some kind of signature in our related disease. So today, I would like to introduce a couple of my study I've been doing before and now I'm on the way. So I hope that you guys enjoy this time as I am now. So today I'm going to briefly talk about how alcohol use disorder are developed and also talk about two different kind of major topics, how astrocyte and neuron interaction has a role to resolve reward seeking pattern change. And also I would like to introduce one of our recent study, how this intermingle activity between astrocyte and neuron affect the alcohol withdrawal symptom, especially the anxiety-like behavior according to the age-dependent manner. Okay, I believe that I don't need to intensify how alcohol affect our society as a kind of molecule. This is very unique one because our society admits us to have the alcohol drinking for euphoric effect. But when you use that as a not a good way, there's a tons of the big burden to our society. According to the previous study by the WHO, there's more than 3 million deaths from harmful use of alcohol every year. This is the same amount of 6 deaths every minute. And also even in the United States, in the past 2 decades, there's the doubled up of alcohol-related death. But still, we just have a 4 medication, 3 target, which is approved by FDA. And even worse is the fewer than 10% of people who has the alcohol use disorder are just receiving any form of treatment. So still we have the big needs for potential therapeutic target development and also many of the interest from you guys. So please have some kind of interest in our topic and also any kind of research we are doing now. Obviously, one of the reasons that it's hard to overcome and also know what is the alcohol use disorder and what is the kind of the mechanism for that is the complex, the neurocircuitry domain who is working for alcohol use disorder development. We can say 3 different kind of domain, like any other substance use disorder. One of the stage is binge intoxication. When you drink alcohol, we like it. That's why we drink. But as time goes by, the threshold for that is changed, and also seeking behavioral pattern can be shifted from goal-directed one to habitual seeking behavior. Some of the ganglia, basal ganglia circuit for the reward and incentive cell ion circuit are involved in this kind of transition. Another aspect we are looking at is the circuit for emotion and stress circuit. During the alcohol withdrawal from repeated exposure, people are suffering from several negative symptoms, which can be very negative reinforcement to drink again, which can be the relapse drinking. There are like anxiety, sleep disturbance, social impairment, even the physical pain is happening during the alcohol withdrawal. So we are also studying like what kind of brain circuit and also cellular activities happen to make this kind of withdrawal symptom. Another aspect we can see is like craving behavior. Patient knows that there will be like negative impact their society, their kind of life, but they can't stop drinking about it. So some like prefrontal cortex circuit for like executive functional circuit is working for that. This positive feedback each other circuit make the symptom of that is worsen and worsen. So in our lab, we are studying the mechanism study, how alcohol affect our brain, and also what kind of brain adaptation is happen in the intrinsic property and synaptic property, and also circuit-independent manner. And we evaluate this kind of finding with the rodent behavior evaluation. So majorly now I'm working how alcohol is working as a liver, and also what kind of brain adaptation is happen during alcohol withdrawal. Those are two major things now I'm studying. Okay, let me introduce one of the study I've been doing before. Okay. Strata region is one of the four brain region that has been spotlighted because its role to make our thinking to the movement. Kind of the view to see the addiction as a kind of the transition of our thinking is going to be like the behavior. The stratum area has been spotlighted in the addiction field as well. There are two major cell type we are looking at. Of course, there's other kind of minor cell type. There are two major cell type, GABAergic cell, which is called the direct pathway medium spine neuron and indirect pathway medium spine neuron. They has a very important role to make some our like the movement. For example, when there's activation of direct pathway message neuron activation, it gives the signal to our body to make some kind of the action, like go, do more, do more. But at the same time, even if both of the direct and indirect pathway emission neuron release GABA, because of different kind of circuit, the indirect pathway emission neuron activation makes some kind of no-go signal to our body. Don't do that, don't do that. So when you have the determination of the behavior and also the kind of movement, the balanced behavior is made by this balanced activity by these two medium spine neurons. But so far, people barely know about that. What are the rules by the other cell type, like the astrocyte in the brain regions? One of the reasons I'm interested in for that is the accumulated information that people, it has been known that astrocyte has a role of like the structural background of the brain. But as time goes by, now we know that astrocyte itself has a making the tripartite synapse and also directly giving the signal with the neighbor neuron back and forth. So as you can see here, one of our 3D reconstruction data, the astrocyte process has a very tight junction with the blood vessel with end foot, but at the same time, they overlap the synaptic cleft to make some kind of formation. Indeed, they have a different role to modulate the cellular activity in different way. So major two way we are looking at is the scavenging. The first one is scavenging. So when there's a release of a neurotransmitter in the synaptic cleft, obviously there's a receptor receive that, and then there's a signal cascade in the post-synaptic area, the cellular activity. But the remain, the neurotransmitter can be scavenged into the astrocyte and metabolized inside, and then transferred to like the presynaptic area again. So this kind of scavenging effect makes some synaptic area go back to the normal stage for that they are ready for the next signal, like the action potential based release of neurotransmission. Another aspect we are looking at is the role of astrocyte of like the release of glial transmitter. There's a direct release of glial transmitter, and then they can affect the GPCR in the synaptic area, giving the signal like the modulation of the release of glutamate direct modulation of the neurotransmitter release directly. So this intermediate activity between neuron and astrocyte is important to modulate the transmission. Also, it has been known like neuron-neuron interaction, and then they give a signal to downstream of the brain region. But people still on the way to looking at how local astrocyte activity affected the neighbor neuron activity and also further like affect the downstream or brain widely. So we are also very interested in to looking at this kind of role of local astrocyte, how they affect the whole brain. So for doing this kind of experimental strategy, we are using the techniques like this. This is my old playground. So we can activate the cell type specific cell type dependent activity with chemogenetic or optogenetics. So I believe that I don't need to go all kind of details of chemogenetics, but basically, like briefly, the backbone is like GPCR. So there's a 2 or 3 substitution of some kind of residue. So this kind of receptor is not working with endogenous ligand, but there's a when there's a like the artificial ligand, they are going making some kind of signal cascade pass through like their backbone signaling. So for example, when you use the HM3DQ, one of the thread, the chemogenetics, this is a human muscarinic receptor subtype 3, which is a GQ pathway. So when there's a release of, giving the kind of artificial ligand, we can make some GQ pathway signal cascade activation inside the cell, which makes increase calcium or something. Also, we measure like calcium or other neurotransmitter release with the fluorescence-based marker. Because the astrocyte, there's no action potential. So calcium level change, the fluctuation is one of the best way we can measure cellular activity at the moment. So we confirm the cellular activity with calcium imaging and also evaluate how they affect the neuron activity with ex vivo and in vivo electrophysiology combined with the optogenetics. And evaluate this brain activity with the rodent model, the behavior evaluation, and confirm this change with the transgenic approaches like the deletion or overexpression of the specific molecule in the specific cell type and the brain regions. So let me introduce the 2 kinds of the study for today. So as I mentioned to you before, like to know how the local astrocyte activation in the dorsal cellular area affect the neighbor neuron activity and also consequent behavior, especially in the seeking parents, we use the chemogenetic activation in the astrocyte in the dorsal cellular area. We confirm that they are just localized in the astrocyte, non-neuron or microglia, and then did like some kind of behavioral evaluation. But when I started this kind of project, many of people use the DRAD system like the chemogenetics for neuron activity change, but barely used in the astrocyte. So we wanted to confirm they are working the astrocyte as well. So what we did was we made like GChem, one of the fluorescence-based calcium indicator expression in the astrocyte by making the transgenic mouse, the ALDH1L create dependent like the expression of GChem. So when there's an increased calcium in the astrocyte, we could see the intensity change of the GFP color when you measure that. So in this case, we implant the lens inside the brain and use the head-mounted microscopy. We measure what kind of signaling we can see that. This is one of the example we are looking in the dorsal cellular area. As you can see here, there's a basal levels of the fluctuation of the calcium. But when you give the systemically the ligand, this compound 21, there's tons of increased color of the GFP in the dorsal cellular area of the astrocyte. So we confirm that chemogenetic is also working for activation of astrocyte well. And then we measure the behavior with the open chamber seeking behavior pattern change. So the method we were using was the outcome evaluation procedure. In the open chamber, mouse were exposed to the kind of condition. They trained to nose poke a hole to gain the liver. So they know that when they nose poke the the whole, there's a liver they have. And then they have the exposure to like the outcome devaluation process. So in their home cage, they are exposed to the liver. They learned here till the satiety. So the liver itself is devaluated by giving to satiety at this moment. And when they exposure extinction test again, we can measure the desired level of they have by the number of the measure, the no smoking numbers. Same mouse can expose this kind of paradigm 2 times with or without outcome devaluation. So when we compare the no smoke level, when there's a reduction of number of no smoking, when they pass through like the outcome devaluation, we can say now they have the pattern of seeking, goal-directed seeking. Because when they have like certified amount of liver in the home case, their no smoking is reduced. But even if they pass through the outcome devaluation, their no smoking level is the same. This is their stage of the habitual seeking because whenever there's a stimuli, they have like some kind of response about it. So with this kind of paradigm, we measure how the DMS astrocyte activation affect the behavior. Very interestingly, when you train the mouse have habitual seeking behavior, after activation of the astrocyte in the DMS area, they shows the pattern of a goal-directed seeking. This is transition of the behavior. Wow. So we want to know that how they affect the neighbor neuron activity, and then this kind of consequent behavior happen. As I mentioned to you at the very beginning, those are two major cell type. We confirm what kind of cell type in the dosimetry stereo area with the transgenic mouse approaches. As you can see here, more than like the 90% cell are D1 or D2 positive neuron. And I mean, in the case of the neurons, the most of the neuron are D1 or D2 positive neuron, and they are not overlap much. It's below the 1%. Obviously, there's other cell type like the PB positive interneuron or cholinergic interneuron. But in this project, we focus on the major cell type or D1 and D2 positive cell. D2 positive neurons. And we evaluate what kind of the synaptic event happens. Long story make it short, the most tremendous change we found was when there's activation of astrocyte, the D2 positive IMS neuron now, the glutamagic signal was tremendously reduced, and which makes some final net charge that the D2 MS neuron excitability increase. So we are focused on these kind of things. And also at the same time, we would like to know that if this kind of the local event happen, how they affect the downstream. To measure this one at this moment, we were focused on like in vivo electrophysiology. We express two different kind of things by the injection of AAV virus into the DMS area. One is the pre-dependently express the channel adoption. So we express the channel adoption only in the IMS neuron. And at the same time, we express the chemogenetic excitatory like the DREAD, GPCR, into the astrocyte by the injection of AAV, GFP promoter-driven HM3 expression. And with this kind of condition, we measure neuronal firing in the external part of globus pallidum, which is one of the downstream of the structure area. And as you can see here, when you give the blue light stimulation in the DMS area, we could see there's the silence of neuron, and we confirm that this kind of signal was GABAergic. So now when you measure GP neuron activity, now we confirm that this neuron we are measuring are receiving the signal from the DMS. And with this kind of condition, without the light stimulation, we just systematically activate the astrocyte by giving the ligand, and this makes some activation of astrocyte only in the DMS. And this event makes some reduction of GP neuronal firing. So with this kind of data, full support that the local DMS astrocyte affect the neighbor neuron activity and also further the downstream circuit in the GPE as well. So yeah, now we know that the sequential. We want to know that why there's a change of neuron activity when there's activation of astrocyte. So when I was measuring this one, I was have several kind of the project to measure how they affect several different molecule. And one of the things we found was the adenosine signaling when you give the path application of adenosine has very similar effect like we saw by the activation of astrocyte. So we set up one of the hypotheses like when there's activation of astrocyte, there's increased adenosine in the extracellular area, which can affect the reduction of GABA signal, which makes some excitability increase of D2 positive emission neuron. To check this hypothesis, we did like chemogenetic activation combining with the pharmacological approaches. So this is the ex vivo brain slices. That we express the astrocyte specifically HM3DQ and then measure the neuron activity in the T2 GFP positive transgenic mouse. And this is confirmation of our recording by the insertion some of the neurobiota in the intracellular the recording solution. So when you activate the astrocyte, we could see that there's a reduction of the GABAergic signal, but this GABAergic signal, the reduction was disappeared when you pretreated with DPCPX, which is the adenosine A1 receptor antagonist. So we can say that at least in the dosomedial area, the astrocyte activation induced the reduction of GABAergic signal in the D2 positive IMSN neuron is by the adenosine receptors. We want to know that how the adenosine is increased in the extracellular area as well. There are two major pathways we can think about. One is the ATP vascular release, and they can metabolize to the adenosine by the activity of some enzyme. Another way we can think about was like adenosine can be passed through according to the concentration inside and outside through the like adenosine passive transporter ENT1. So to confirm what will be the major one to make some increase of adenosine, we block one of the signal cascade. When you pretreated with some pharmacological approaches like the ectonucleotide inhibition, we still could see like there's a reduction of the GABAergic signal. But interestingly, when you block pharmacologically the ENT1 activity, the astrocyte activation induced the neighbor neuronal GABAergic signal reduction is disappeared. To confirm this one more firmly, we used the ENT1 knockout mouse, and then we did the same kind of experimental approaches. And as you can see here, ENT1 knockout makes them disappear in the GABAergic signal reduction induced by astrocyte activation. So this data suggests that at least in the dosomedial area, the astrocyte activation affected the neighbor D1, D2 positive IMC neuron via the adenosine and the activity of the ENT1. So now we know one of the mechanical, the kind of pathway. So no reason not to test how they affect the behavior, right? So previously, we checked that astrocyte activation by the chemogenetic activation makes some seeking behavioral pattern change from habit to goal. So we test the same thing, the ENT1 knockout mouse. And even if we activate the astrocyte, this behavioral pattern change was not happened. To confirm the local ENT1, the importance of local ENT1, we overexpress the ENT1 only in the DMS in the ENT1 knockout mouse. And as you can see here, when I did the same kind of astrocyte activation in the DMS, the habitual seeking pattern shifted to goal directed was restored again. So this data suggests that astrocyte could be activated by one of the GPG signaling, and then they can release the glial transmitter to the neighbor neuron in different way, and also affect the behavioral pattern change from habitual seeking to the goal-directed seeking. So with this kind of data set, I would like to say the local astrocyte affect the downstream neuronal activity, and also I would like to intensify this. The same kind of signaling affect the neuron activity in a different way according to the neuronal character they have, like the different receptors and also different kind of transport as well. Now, this kind of study are extended more. So not only for the dosomedrestral area, one of the downstream, the the external part of the glossal pallidum, the intermingle between astrocyte and neuron activity also affect the behavioral seeking pattern change. This study is extended in Mayo Clinic Dr. Choi's lab. So if you are interested in this kind of story, you can also check other kind of the publication published in the last year. And also as the extended study as well, the sterile area, as you can see here, is not very small. So we wondered if the dosimeter sterile area and the posterior part, which is the name of the pterostrium, has the same kind of trend in the determination of the behavior. So now we are on the way to check what kind of the neuron activity and also the interaction with the astrocyte affect the behavioral constant. So as you can see here, we are on the way to measure that. Very interestingly, the pterostriatum and dosimeter striatum in somehow has a different kind of determination to have like the cell type and sub-region dependent cell lines bias when there's activation of different kind of neurons. So now we are working on that as well. Okay, let me move on to another part of the study I would like to introduce to you, focusing on more about the withdrawal symptoms. At the beginning, I mentioned to you there are only like the four medication and three target for like pharmacotherapeutic strategy for alcohol so approved by FDA. Very interestingly, not like any other treatment, this kind of drugs are not blocker or antagonist or agonist. I mean, specifically the alcohol homolog or something. We have like different kind of strategies to ameliorate the symptom or like to have the condition making the alcoholism disorder patient has a condition not seeking some kind of the alcohol by some giving like producing uncomfortable physical effect or like reduce the value of alcohol, or we can do like medication giving the situation ameliorate the negative symptom they have more like less and less. Um, it has been known well that during the withdrawal, there's a tons of increased hypobrain activity by the increased glutamate signaling. So now I'm also interested in how the hypoglutamate stage is made by alcohol withdrawal age dependently. So to know what kind of negative reinforcement happened during alcohol withdrawal, we are looking at what kind of behavioral consequence they have, and also what kind of brain activity happened, when, where, and what. So let me introduce one of the study we are doing now. This is a project showing how adolescent alcohol exposure affect their behavior and brain adaptation when they are grown up to adult. So in this paradigm, we exposed alcohol intermittently and repeatedly during the adolescent period in the mouse rodent model, and then measure the brain and also behavior when they're grown up during having the 4 weeks of withdrawal paradigm. Interestingly, when you evaluate their anxiety-like behavior in adulthood, of the mouse exposed to alcohol repeatedly during the adolescent period, they shows the angiogenic phenotype. I believe many of you guys are already familiar with how we measure anxiety level, but basically this is a paradigm, the approach avoidance conflict. So animal has a natural born to be having the preference to explore somewhere they never been visited before. But when they have like anxious behavior, it's hard to go out or go somewhere. When they overcome this kind of anxious anxiety levels, they can go somewhere. But if they have like very high anxiety level, it's hard to go somewhere. That's why we can measure the anxiety level with this kind of the time they spend in open field in the center area, in the light dark box, in the light area, and also elevate plus maze or zero maze. With the time they spend in the open arm, we can measure what kind of level of anxiety they have. And in this paradigm, when you measure the anxiety level, they shows that higher anxiety level when they expose to alcohol repeatedly during the adolescent. one of the brain region we are interested in now is the small dorsal thalamic area, which is called the periventricular nucleus of thalamus. They have very strong projection to nucleus accumbens and central amygdala and also prefrontal cortex, which are all important to resolve like the seeking behavior and also emotional behavior. Previous study shows that periventricular nucleus of thalamus has very important node in the emotional processing network. And also at the same time, there are many groups showing like early life experience affect the periventricular nucleus of thalamus activity. So we hypothesize previously many groups shows that PBT hyperactivity is observed during like many of the conditions, especially when there's hyperactivity of the PBT, there's increased anxiety and also hyperarousal stage. So we hypothesize what if the adolescent alcohol exposure affect the PBT neuron activity, which can be one of the patterns they show in the adulthood, increased anxiety. To confirm this one, we approach several different kind of level, in vivo electrophysiology, biochemistry, and also photometry. As you can see here, when you measure the neuron activity in the PBT, there's increased firing. And also at the same time, when you measure the immediate origin, which CFAS or delta phosphate is one those are the immediate origin. When you measure delta phosphate, which is one of the good markers showing like repeated experience-based neuron activity, there's an increased level in the group exposed to the alcohol during adolescence. Also, okay. Also, we would like to know the spatial temporal brain activity, what kind of the activity they shows when they explore the open field. So, as I showed you at the very beginning, like the transgenic mouse, the GChem expression in the specific cell type. In this case, we inject the virus to express the GChem in the neuron of the thalamic area, especially the periventricular nucleus of thalamus. And by the implantation of the optic fiber, we measure their behavior, synchronize the kind of location information they have. So this is one of the examples. We saw that they can freely moving in the open field. And then when we measure the brain activity, we can also know that where they are and how they go inside or not. So when you compare their brain activity and the PBT neuron activity during the open field test, as you can see here, the alcohol exposed mouse shows the higher the cellular activity when they stay in the central area. And also when you dissect all kind of signaling pattern sorted with their behavior when they go inside, they shows increased the calcium levels of a neuron when they go into the center. So this data suggests that all kind of data, there's a heightened neuron activity in the PBT, the brain region of the mouse when they expose to alcohol during the adolescent period. We want to know that if this is one of the big pattern to see the behavior, one of the way we can confirm this one is manipulate the cellular activity in the opposite way and see if it could the rescue the behavior pattern. So what he did was like the chemogenetic inhibition of the cell in the neuron, the PBT area. And as you can see here, when you silent the PBT neuron activity, it can rescue the high anxiety-like behavior without the effect to the locomotion. Mechanism, what kind of things happen over there? Of course, there's many things happen, but one of the things we are interested in is the glutamate clearance. Astrocyte has a role to scavenge the glutamate as well via the two different kind of dominant glutamate transporter, GAT1 and GLAST. So previously, we saw that one of the epithalamic brain region during the alcohol withdrawal, there's a reduction of the function of GAT1, which makes some pathophysiological increase in neighbor neuron activity, can make some symptom during the alcohol withdrawal. This is one of the example. We measure ex vivo electrophysiology. DHK is a glutamate blocker. Normally, we could see that when we pre-treat the DHK in brain slices with application, there's an increase the glutamagic signaling. But during the alcohol withdrawal, this kind of the increased glutamagic signaling is disappears. So we want to test it, what happened in the PBT area as well. So with the enzyme assay, when you measure glutamate level itself, the alcohol withdrawal, the adulthood exposure to alcohol during adolescence increase the glutamate level. And cause the glutamate transporters are one of the interest, we checked both of them. And as you can see here, the GLT-1 level is significantly reduced in the mouse of the dorsal-thalamic area of alcohol exposure during adolescence. So to know that this reduction has an important role in the anxiety-like behavior, we made the transgenic mouse model, which reduce the levels of GLT-1 in the astrocyte. When there's a total, like the non-specific knockout of GLT-1, it's going to be lethal, like 4 to 5 months old. So we are focused on like the GLT-1 heterogeneous knockdown model, which is very similar that we saw during the the adulthood of the mouse who has the experience of adolescent alcohol exposure. And when you compare this, the control mouse and heterogeneous GLT-1 knockout mouse, we could see that there's an increased glutamagic level in the thalamic area by the magnetic resonance spectroscopy without any kind of the invasion of the surgery. So this data, when we saw this kind of data, we was very happy that, oh, this is the model we would like to measure several behavior. And when you measure the anxiety level, this mouse shows that angio-like phenotype in adult. So this data suggests that GLT-1 knockout is one of the pattern we can see the angiogenic phenotype in mouse model. So to confirm the importance of the PBT, we, in this case, specifically knock out the GLT-1 in only the PBT brain region by the virus injection. This is one of the sample we cut. This is the punched area for like the evaluation the levels of GLT-1 for like the Western blotting. As you can see here, the GLT-1 level in the PBT is tremendously reduced, and also DHK-induced neuronal firing is disappeared in the PBT brain regions. So with this mouse, when you measure the glutamagic, when you measure the anxiety-like behavior, as you can see here, this GLT-1 deleted mouse in the PBT area also shows angiogenic phenotype. So we would like to test the opposite way. We have another mouse model can be overexpressed the GLT-1. So we expose this mouse to the alcohol during adolescence, and at the end of like the paradigm, we inject the virus to express the GLT-1 in the PBT area. And when you measure the anxiety level when they're adulthood, as you can see here, the adolescent alcohol exposure-induced angiogenic phenotype is rescued by the PBT GLT-1 overexpression. So this all data suggests that adolescent alcohol exposure repeatedly induced hypoglutamate signaling, especially in the psyche related to affective disorder, and also the dorsal-thalamic area. And glutamagic normalization via the overexpression of GLT-1 can be one of potential therapeutic target for alcohol use disorder and also the comorbidity induced by alcohol use disorder. Thank you for your attention for today. I'm very happy to share some of our study. Those are our lab members, and also we are collaborating like several different groups nationally, and especially when I express my appreciation to my previous mentor, Dr. Dusop Choi. And I would like to clarify many of the data with the brain slices, ex vivo, and also immunofluorescence was made with one of the machine from Precisionary, the vibratome. Thank you.
Thank you so much. The compressed dome. Thank you so much, Professor Kang.
Yeah.
Yeah, So I'm going to open it up to our webinar speakers. Sometimes they can unmute. I'll also keep an eye out. We didn't have any comments or questions in the chat room that I've been moderating. And we have a comment that says, thank you very much for your insightful talk. So I wanted to pass that along. And sometimes we wait a little bit. If not, we'll wrap up just in case.
Yep. And also, yeah, as you can see here, I'll just remain my email address. When you have any kind of question or suggestion, please don't hesitate to contact me, please. Yeah.
Okay, we have a written question here. I'm going to read it, okay, Dr. Kang?
Yep.
We have two. One is, based on your talk, how would you say the temporal release of specific glial transmitters by astrocytes influence the transition from reward-seeking behavior to dependence and alcohol use disorder? That might be a very general question. I might ask them to clarify.
Yeah, that's good question. So there are many other different kind of glial transmitter, and according to the astrocyte where it's localized, they're spatiotemporally released, not only for the scavenging, release the glial transmitter, affect the neighbor neurons. In this project, we forced to increase the levels of adenosine by activation of astrocyte, but temporarily they can also release according to the behavioral pattern they have. Actually, I just cut down one of the study and follow up this one. Actually, we also measure the alcohol-seeking behavior pattern. Mostly when you measure the interaction between astrocyte and neuron in the dorsal area, we can also manipulate the alcohol-seeking pattern as well. But the measurement we can make can be a little different because the real value when you measure in the open chamber for alcohol and screws like the natural reward can be a little different. But bottom line is when there's astrocyte activation as well in the dorsal area, it can also ameliorate the seeking pattern of the alcohol as well. So I would like to have a chance to discuss this matter later as well. Yeah.
Very cool. There's another question that was entered, and it says, I just want to get your thoughts on how you think astrocyte-mediated synaptic plasticity can contribute to the neuroadaptations observed in alcohol use disorder, to help explain the transition from initial reward seeking to long-term dependence. That's a very good
Definitely.
question. Well, I would love to
Definitely.
hear your response to that too, Professor Kang.
Yeah, that's very good question and also kind of insightful, like,
Very, very hard question. It's a whole
yeah.
career's worth, right? Yes.
Yeah, I can just devote all my whole life to investigate that kind of matter. Yeah, indeed, yeah, it's possible because like the neuron adaptation, we can also see there's a different levels of astrocyte adaptation, which also has a different levels of receptors and also release of glial transmitter. It can be like third critics to make some neuronal plasticity as well. According to the brain region, we can see the plasticity as well. Especially when you see the neuronal plasticity in the striatal area, not like the hippocampal area, we need more effort to make some plasticity. For example, not only for the optogenetics, like the high frequency, we need to increase the cellular the voltage at the same time. So I believe that the role of astrocyte can be also in there when you want to make some kind of neuronal plasticity, especially in the circuit for like reward seeking or like reward. Yes, definitely there's some kind of role for that. Yeah.
Very cool. Well, there are no more questions, and I want to thank you again, Professor Kang, for your time and your talk today. And thank you for all of you guys who came. I wish you the best, and we hope to hear more about your work in a year or two.
Thank you. Yeah, I
Take
will.
care.
Thanks.
Thank you.